So today we're going to use some laser therapy to help Greg with a hand injury that he sustained last night while playing soccer. So I'm going to let Greg kind of explain where he's hurting and just briefly about how it came to be an injury to him.
Sure. So I've always had hand injuries since high school. I think I re-injured part of my hand last night. Took a bad fall. So we're not really sure what's going on, but as Dr. Welling will talk about, the laser can be great for a little bit of reduced inflammation and pain. So we're going to see how it works, and we'll talk our way through it.
Cool. So as we do class 4 laser therapy, you always want to be cautious, and we'll cover our eyes with glasses. So we're going to put these neat glasses on. All right. So like Greg said, we use the laser therapy for a lot of different conditions. I wouldn't be able to name them all right now, but some of the most common ones are arthritis, sprains and strains, bursitis issues, pain from muscles that get pulled, and rib pain, joint pain. There's just many reasons that we can use it. Headaches, neuralgia, those sorts of things. But today we're going to use it to reduce and to lower the inflammatory process from this injury that Greg has in his hand. So I'll have Greg just sit right there, and we've already got the laser up and running. This is a class 4 laser, so this is not considered to be a cold laser. This is a hot laser, a warm laser. And what we've done is we've already dialed in the protocol for his specific region of injury, which is going to be the hand. It's going to be a short protocol, and we'll go ahead and start that now. You'll hear some beeping that's going to come from the laser itself. So what we'll do is we'll go ahead and I don't know if the camera will pick it up or not, but there's a red light right there, and that red light, that if you can see it in the camera, actually does nothing. This is a far infrared light that we're using, so the red light is actually just kind of a spotting spectrum so that we can tell where the laser application is going to be on the hand. And so I'll go ahead and start that now, and we're going to run that right along the edge of his hand right there, which is where he's been hurt. And we're going to go nice and slow, and this should be relatively very comfortable to the patient. In fact, I'll let Greg kind of explain how and what he feels there.
Sure. It's just a light warming. Really, it feels kind of nice. It's just like you're out in the sun. Nothing more uncomfortable than that.
Yeah, it tends to be a very comfortable treatment, very soothing as well. We can't hold it in one place, because if we don't move it, it will feel very warm or uncomfortably hot on the skin. But if we keep that slow movement going, it's spread out consistently over the surface of his skin, and then he should feel the energy exchange from the light as it touches the skin and pushes down past the skin into the tissue. And so we'll have Greg go ahead and just turn his palm over there, because we want to be treating from both sides. Depending on the area that's being treated, we choose different energy amounts. And because we're doing a hand, this is a much smaller energy dosage. And so this application is only going to be a total of just probably about 2 minutes or so. Obviously, if we were treating something with a little more mass to it, like a shoulder or a hip, the energy dose would be significantly higher, and the treatment time would be quite a bit longer as well. I'll turn that over again there. Oftentimes, depending on the situation, we'll use a couple laser therapy treatments because they build upon themselves. So if we want to reduce that inflammatory cycle, and you just heard the end of that beeping, perhaps, I don't know what you can hear on that phone, but that indicates that we're done with that application to his hand for now. So anyway, back to what I was saying, depending on what we're treating and the reason we're using laser therapy, it can be very quick. It can be 1 or 2 treatments, or we may need a series of care. so that the treatments can actually build upon themselves to optimize reduction in inflammation and enhancement of healing that can take place in the area that's being treated. So we're all finished now. Any pain with that, Greg?
No, it actually feels a lot better, and the treatment itself is really kind of pleasant. So
Yeah. Got it.
good to know.
Some people will feel instant relief from laser therapy, and other people will feel it come on over the course of a couple hours. And so we always want to be clear about that if somebody gets up, and although most people will feel a better range of motion, they'll feel less pain relatively very soon, there are those that won't feel it for 3 to 6 hours after they leave the office. So we just want to make sure that we're clear about that. All right. So thanks for being with us and letting us talk to you just a little bit about laser therapy. If you have any questions, give us a call, 303-424-9549.
See you next time.